Hi, I'm Dr. Kara Christ, Director of the Arizona Department of Health Services. Since Thanksgiving, when many gathered with loved ones and friends, we've seen the COVID-19 metrics worsen. As predicted, we saw a significant increase, over 52% in the number of cases 1 to 2 weeks after Thanksgiving. Our cases remain elevated, as does our percent positivity. We are seeing increased hospitalizations and deaths. COVID-like illness continues to show increasing use of the emergency room and inpatient beds. Parties and social gatherings in informal settings are the most concerning, especially as we head into Christmas and the New Year. While many people are good about wearing their mask when they are out in public with strangers, many then head home and invite friends over for dinner where people don't wear masks or distance. These create situations where COVID-19 can spread more easily. Our updated holiday guidance focuses on factors that produce various levels of risk. You are safest at home spending time only with those that you live with. It is important to keep any risks in mind if you decide to get together with people from outside your household. COVID-19 transmission is currently widespread throughout Arizona. Your risk of catching COVID-19 increases greatly when there is more spread in the community. This includes not only the community risk where you live or work, but also the community spread where your guests live and work. Be aware of how much community spread is in the area where you plan to celebrate, and assess the risk of hosting or attending a holiday gathering. Larger social events or gatherings pose a higher risk of infections than smaller ones. If you choose to gather with people who don't live with you, limit the attendees to 10 or fewer while masking up and maintaining distance. If weather permits, consider hosting your event outdoors. Social events with more preventive measures, such as moving the event outside, mask wearing, physical distancing, and hand washing, pose less risk. We have more tips for safely celebrating the winter holidays on our website at azhealth.gov/winterholidays. This is also a very important time for religious celebrations where people come together. These settings can be high risk for the transmission of COVID-19. This year, we recommend celebrating religious holidays virtually whenever possible. If you can't celebrate virtually, there are ways to reduce your risk. Wear a mask and practice physical distancing if you attend a celebration with others you do not live with, especially if there is singing involved. Choose a celebration time that is less crowded or celebrated outdoors. Avoid shaking hands or hugging people who do not live with you. Avoid drinking from communal cups. And if you are over the age of 65 or have a high-risk medical condition, consider celebrating virtually. This week, over 90% of ICU beds and inpatient beds in the state are currently in use. This has ADHS on high alert, and we remain concerned about the trends in Arizona. These are beds that are not only used to treat COVID-19 patients, but all types of acute medical issues, including heart attacks, strokes, serious injuries like car accidents, and infections. We want to make sure there are beds for any medical emergency that Arizonans may face. Our doctors and nurses on the front lines need our help in order to preserve the limited beds for those that most need it, whether it is COVID-19 or some other medical emergency. The way we help is by always wearing a mask and physically distancing whenever you are with people you don't live with, and washing your hands frequently. We're excited to have the first doses of COVID-19 vaccine in Arizona. By the end of this week, we expect to have over 200,000 doses of vaccine. Healthcare workers have started to receive the vaccine, and long-term care facility residents and staff will be receiving the new Moderna vaccine starting late this week or early next week. These vaccines have been subjected to scientific testing and clinical trials and are safe and highly effective. As a medical doctor and public health professional, I received the Pfizer vaccine last week. I've had no side effects besides a little soreness at the injection site, which is normal for me. I hope my experience helps give everyone confidence in the COVID-19 vaccine. When your place in line arrives, I urge you to get vaccinated. This is the light at the end of the tunnel. However, it will be a number of months before the vaccine is available to all, so we must continue doing all that we can to mitigate the spread of COVID-19, including taking precautions every time you are around people who aren't members of your household. Wear a cloth mask over your nose and mouth. Maintain at least 6 feet of physical distance. Wash and sanitize your hands often. Stay home if you feel sick, and avoid crowds. To find out more about COVID-19, including recent data and additional prevention strategies, please visit azhealth.gov/COVID-19. As much as I enjoy celebrating with my extended family, I will be following our public health recommendations this holiday season and only celebrating with my immediate household. I am doing my part to contain the spread, protect my family, and preserve limited hospital resources for those that truly need them. My team and I at the Arizona Department of Health Services want to wish you and your family a very happy holiday season and a healthy new year. Thank you.